Diabetes Connections is brought to you by inhaled insulin, glucose management in the moment, by Omnipod 5, the only tubeless pump that integrates with Dexcom G6, and by Dexcom, keeping you in control with an integrated system for diabetes management.
This is Diabetes Connections with Stacey Sims.
This week, one of the oldest diabetes companies looks ahead. Once part of BD, makers of needles and syringes, Embecta is now working on new technology like a patch pump. I'm talking to CEO Dev Kurdikar about moving the company forward while still serving the patient community that relies on the tried and true basic technology. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I'm your host, Stacey Sims. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. And over the years, the show has really taken a focus on technology and on bringing your questions to CEOs, these technology companies, as we kind of keep up with a lot of changes in the industry. And I remember talking to the folks at BD many years ago at Friends for Life, that big conference that happens every July in Orlando. And they pointed out that it is easy to get overshadowed by the new technology of closed loops and pumps and CGMs. But you still need all the stuff that they, now Embecta, make. The sharps, the needles, the syringes, they don't get the same kind of breathless coverage, but they're very, very necessary. As you may recall, Embecta spun off from BD just over a year ago, and BD has been around for just under 100 years. They started making the world's first specialized insulin syringe in 1924. They are working on a lot now, including a patch pump that has FDA breakthrough status. So my guest to talk about all this and more is CEO Dev Kurdikar. I reached out to him after seeing Embecta ring the opening bell at the NASDAQ a couple of months ago. They had invited advocates and groups such as Beyond Type 1, Children with Diabetes, Diatribe, the Diabetes Link, and so on. I thought that was interesting and pretty smart, and I was curious what they wanted the diabetes community to know. So we'll find out in just a moment. But first, Diabetes Connections is brought to you by Afrezza. And since starting this podcast, one of the highest interest topics has been Afrezza inhalable insulin. I am so excited to partner with them to tell you more. Afrezza is an ultra rapid-acting mealtime insulin. You breathe it in using an oral inhaler, and once inhaled, Afrezza passes quickly through your lungs and enters your bloodstream in less than a minute and may start reducing blood sugars within about 12 minutes. Find out more, see if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium, is not for patients with chronic lung disease such as asthma or COPD, or for patients allergic to insulin. Tell your doctor if you ever smoked, ever had kidney or liver problems, a history of lung cancer, or if you are pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use on afrezza.com/safety. Dev, thank you so much for joining me. I am eager to learn more about Embecta. Thanks for spending some time.
It's my pleasure, Stacey. Thank you for having me.
I wanted to start at the event that really caught my attention here and caused me to reach out. And that was that last year, Embecta rang the opening bell at the NASDAQ. And it wasn't just company representatives. You had people from the diabetes community, Beyond Type 1, the Friends for Life, Children with Diabetes folks, diabetes camps. Why was it important to you to include all of these advocates?
It was a really important occasion for us, having the chance to ring the opening bell at the NASDAQ on November 1st. And obviously, as you well know, that was National Diabetes Awareness Month. And we thought, what better way to use the platform that we have to bring greater awareness to diabetes, which affects more than 500 million people around the world, by inviting so many of the organizations and groups that work tirelessly every day to make life better for people living with diabetes. And so you were correct. At that occasion, at the ringing of the NASDAQ opening bell, it was actually most of the people on the stage and in the pictures were from the advocacy organizations, There were clinicians, caregivers, people who are living with and managing their diabetes themselves. And we were just honored and privileged to be part of that group that was there on stage.
It really caught a lot of attention. I thought it was a wonderful gesture, certainly. It was also quite clever because, and it leads to my next question, which is not a lot of people know what Embecta is or does. I think some of us may know you spun off of BD, but not a lot of people knew what BD did. Can you talk a little bit about what Embecta is all about?
Of course, I'd be delighted to. Embecta is a new company, but the business we've been in this business for almost 100 years. Stacey, insulin obviously was first used to treat diabetes in 1922. BD created the first specialized syringe for the delivery of insulin in 1924. And so this business, which had been part of BD, now got spun off and became its own independent public company on April 1st. But we have been making insulin syringes and pen needles for, as I mentioned, almost 100 years. We are now the world's leading producer of insulin injection devices. We make 8 billion units a year. Almost half of our revenue comes from outside the United States. Our products are available in 100 countries around the world. And we estimate that almost 30 million people around the world use our product at least once a year. Education is also central to what we do besides providing insulin injection devices. So we launched the Diabetes Care app a few years ago. That has more than 550,000 downloads now. It's available in 11 countries. It's an app that has content that we are proud of because it's been favorably reviewed by the Association of Diabetes Care and Education Specialists. Keeping with the theme of education, we work a lot with healthcare providers and pharmacists to teach them, if you will, or train them or educate them on the benefits of using shorter needles, injection site rotations, not reusing needles. And then we have some patient facing material as well, how to guides to help people with diabetes understand proper injection techniques and getting started booklets. So, we think of Embecta as a company that is really working every day towards developing and providing solutions for people with diabetes around the world.
When we talk about around the world, on this podcast, we sometimes get very focused on the next big thing in the United States for people with type 1. But when I was doing research for this episode, it really is incredible to think about the worldwide impact. Could you just focus on that again? You mentioned the impact of Embecta worldwide, where people aren't using insulin pumps, where diabetes is not something that is treated with anything right now other than multiple daily injections.
That's exactly right, Stacey. So if you think about sort of the global numbers, right? So almost 500 million people with diabetes, expected to grow to almost 800 over the next 2.5, 3 decades. Most of that growth in the number of people with diabetes is expected to occur in emerging markets. And why emerging markets? For several reasons. The underlying population growth is higher, and people there are getting diagnosed, they are getting treated. And you are right, for cost and affordability reasons, the most likely way that they are going to be able to administer insulin is via using injection devices. We are fortunate to have a strong presence in emerging market that we've built up over a number of years. We have 3 plants, as I mentioned. One of them is in China. It produces product for China and some markets in that Asia Pacific region. We have 600 plus commercially focused folks around the world, and more than half of those are in emerging markets. So for a company of our size, which is slightly above $1 billion in revenue, we have pretty significant emerging market infrastructure. And that is going to serve us and the diabetes community well, because as people get diagnosed and as people begin to use insulin to manage their diabetes, we'll be there to help them in that journey.
We have some other technology to talk about, but before I move on, and this might be a silly question, but what is new? How have syringes and pen needles changed? I know I have listeners who are getting injections in the 40s and 50s and, boiling the needles. And obviously that's long gone, thank goodness.
Right.
But is there new technology?
Yeah, it's actually incredible how much innovation has happened in the insulin syringes and pen needle space. So Early on, the syringes used to be glass, the needles used to be longer and thicker. And these things matter for folks that are going to be injecting themselves multiple times a day for the rest of their lives. Our business has been a leader in driving those innovations. So now we have needles that are shorter, 4 millimeters, far thinner, so the discomfort is less. Certainly, we moved from reusable syringes to disposable syringes. That obviously helps. And since the advent of pens in the 1990s or so, we've been leaders in taking those innovations to pen needles as well. Our scale of 8 billion units a year, the fact that we've been making now syringes and then needles for almost 100 years has taught us quite a bit in terms of how do you make products, each one of which is going to be used by a person with diabetes to inject themselves, of quality that we'd be proud to stand behind. So there's a lot of innovation in the design, but it is important to mention that there is a lot of art in manufacturing those devices as well. The third thing I'll mention, because I know it's important for people when they walk into a pharmacy to have access to our products. Over the last 3 years or so, where there has been so many operating challenges with COVID and then the resurgence of COVID and then coming out of the pandemic and maybe not again, we've been able to keep a continuity of supply of our products so that people around the world can have access to our products. So all of these, help beyond just the product features themselves.
My son has used pen needles and he has used syringes. And, when you think about finger sticks, we think about needle gauges and how thinner and how they are, thinner as the number gets higher.
Right.
I don't want to do too much of a deep dive into needles, but I am curious, is it possible to get thinner and less painful? Is that something that you all are going for? Because it seemed to me that it changed just since my son was diagnosed, that there was a higher gauge. Right back to Dev answering my question. It may not surprise you that he has a lot to say there. But first, Diabetes Connections is brought to you by Omnipod. And for many of you, as you listen, this is going to sound like a weird question. Why do you use the insulin pump you've got on right now? There is a really good chance that you went on that pump 15, 20 years ago because it's what your doctor had back then. And you've never really thought about changing. That was us until Benny's Pump Company went out of business. And I was amazed how much things had changed when we looked for a new one. I am telling you, it is time to take advantage of what's new. If you need a sign to switch, this is it. Omnipod 5, the tubeless automated insulin delivery system, is here, and it's available through the pharmacy, which means you can try it today, even if your tubed pump is under warranty. Fill out the quick online form, see if you're eligible for a free trial at omnipod.com/diabetesconnections. And that link is on the website and in the show notes. For full safety risk information and free trial terms and conditions, also visit omnipod.com/diabetesconnections. Now back to Dev answering my question about thinner needles.
Yes, so needles have certainly become a lot thinner. We obviously have an active R&D effort trying to find ways to reduce discomfort, including making it thinner. But as you go thinner, Stacey, you can imagine you have to be thinking about, it's not whether you can make one needle thinner, can you make them in the billions and the manufacturing process that requires. Also, the thinner a needle becomes, you got to be careful and make sure it doesn't bend while you're injecting yourself. And so there are a lot of considerations to take into account here. We do actively look at ways where we can both reduce discomfort but also optimize, if you will, the insulin delivery itself, right? And one of our newest innovations, Stacey, doesn't really have to do with the needle. It's still a 4 millimeter needle, but our Nano Pro product, which is a pen needle that we introduced, has a contoured hub. And what that contoured hub allows you to do is that when a person is injecting herself, it sort of dissipates the force around the skin so that it increases the chances that the depth at which insulin is being delivered is optimized. So there are a lot of innovations we strive for.
Is that a product that's on the market right now, that contoured hub?
Yes, it is. It goes as Nano Pro.
Does it work? And I apologize, I'm not familiar with it. Is it usable with different brands of insulin pens?
That's exactly right.
All right, very cool. See, I'm glad I asked about the needle gauge. I don't know. Okay, I'm sure I could continue to ask about that. Let's move on to other innovative products that you're working on. I wanted to also ask about the patch pump that I was reading about. As you said, you've been doing injections and syringes and things for so long. Why did Embecta want to move into this part of diabetes?
Yeah, so as we think about the market globally, right, as we discussed, AC, emerging markets, is likely to remain an injection device market,
Mm.
at least for the near to midterm. In the more developed markets, certainly in our domestic market in the US and in type 1 in particular, more and more people with diabetes are using infusion pumps now. And the penetration rate is estimated to be around 35 to 40%. And obviously, infusion pumps have a set of pros that they bring along with it, some cons as well, specifically around cost and affordability. But what we thought was there is a large base of people with diabetes that have type 2. And type 2 is obviously a progressive disease. These people are starting primarily and hopefully with our products as they are injecting themselves. But if they get to a point where they need multiple daily injections and they're looking for more advanced technology, why don't we be the ones to try to develop something for them? So we decided to focus our effort on a patch pump with features that would make it most sort of appropriate for type 2. And so things like, a greater insulin reservoir capacity than the commercially available patch pump in the US, because type 2s often use more insulin per day than type 1. Simplifying the product so that maybe you don't need all the features that are embedded in type 1 pumps, realizing that type 2s are often seen by primary care physicians and who may not have the time or the expertise in the clinic to spend on, if you will, more complex medical technology, and keeping in mind that as a company, our products are already available through the retail channel. So if we can have a pump, and hence we focus on a patch pump, that we can supply people with diabetes using the same channel that they use to procure their syringes and pen needles, we would certainly, advance towards our vision of life unlimited by diabetes, right? By continuing to develop and providing solutions where one doesn't neatly exist today. And so that was sort of our motivation for developing a patch pump that is focused on type 2.
Where are you in the process here? How far along is it?
All we've said publicly so far, Stacey, is that it's being developed under the breakthrough device designation of the FDA. It is certainly a multi-year program, but we haven't made any specific commentary on timing. When at Spin, as part of our conversations with investors, we laid out some, near to midterm projections for revenue all the way through fiscal 2024. And the only thing we said about timing was we hadn't included any revenue from Patch Pump in those projections that we had laid out in March. That's about all we've said on timing.
Sure. Does this pump have a name? Is the project under any kind of name you can tell us?
That's for internal use only.
I always like to ask because sometimes they tell me and they have some very interesting names.
Yeah.
They don't usually make it to market, but I always like to ask. Great. Well, we'll stay tuned on that for sure. A product that you have, though, that is out, that I believe you've required or in the process of, is the Intuity Pogo meter, right? Can you tell me about that?
Yeah, and it's not a product we've acquired. We've actually signed a commercial partnership agreement with Intuity Medical.
Got it.
Which is the parent company that produced and got FDA clearance on Pogo. Pogo is the only FDA cleared automatic blood glucose monitor, and it's hugely advantageous over traditional blood glucose monitors, which, as you know, require many steps. Pogo is a device where that lances, collects blood, and produces a glucose result at the push of one button. And so it makes unnecessary the need to individually load and then dispose of lancets and test strips. This is a truly innovative product. Again, given the channel and the reach that we have in the United States, and knowing that some people may not want to move to a CGM, but may not be completely satisfied with the traditional BGM as well. we thought that if we can put our commercial strength behind bringing this product into the hands of more healthcare providers, more pharmacists, more people with diabetes, again, we would make one more solution available for people living with diabetes and make their life hopefully a little bit easier.
Is Intuity working on other devices like this?
You
Or
know,
is it
that honestly, Stacey, that would be for Intuity to answer.
Got it. Well, then I'll ask you, is Embecta working on other devices like other than those two?
Yeah, no. So our right now we are focused on the patch pump development I talked about. We are looking for ways to innovate in our core injection portfolio, but we are actually actively looking at the landscape to see whether there are other products like Intuiti's Pogo that we can add to our portfolio. From our perspective, we have great strengths in high volume manufacturing and distribution, a commercial channel that we talked about. And what we want to do, Stacey, is add products to our portfolio, both including from internal development as well as externally acquired products, whether it be through M&A or some sort of commercial partnership, and bring that portfolio of products available to people around the world.
I should have asked this earlier, but do you have any sort of personal connection to diabetes?
My father-in-law has diabetes. My mother, who's passed on, had diabetes as well, but it was in the later years.
I started off by asking you about all those great advocacy organizations at the NASDAQ. Are you doing more with those folks? Are you working together? I don't know if you can say anything about what's coming up, but have you decided to try to work more projects with those groups?
Yeah, we are actually our teams, both US and outside the US, and I know the groups that you saw on Nasdaq were primarily US, but Stacey, you can imagine our teams around the world have really close relationships with advocacy organizations that work in many of the countries that we operate. So we are actually in continuous conversations with them. We often talk to them in terms of getting feedback with respect to ideas, either from a commercial perspective or an R&D perspective that we have. So we don't regard that November 1 event as one event, but rather just sort of one event in a long-standing partnership that has existed for a while and will continue to exist.
It must be such an interesting company history, as you said, making needles in the 1920s, just after insulin, was discovered and starting to be manufactured. This is such a silly question, Dev. Is there a building with kind of like an Embecta or a BD, I suppose, museum? I mean, can people see somewhere the photos or the artifacts of this history?
Stacy, so we just moved into our new global headquarters, right? So we moved out of BD space and moved into our own global headquarters in Parsippany, New Jersey. And one of the areas in that new global headquarters is actually what I'll call a customer center. But within that customer center, we've kept space to actually bring forward and sort of install and have people see the innovations that our business has introduced over the years. It's not complete, but over time, it will become a place where you can actually go and physically see the items that we've done, that we've introduced over the years.
Well, I promise if you have any holes in your history, my listeners can find them. They're amazing. And some of them, like I said, can really trace it back a long way.
We'll certainly keep that in mind, Stacey. Would love to have, as you called it, a museum, a historical museum that, provides, if you will, actual products from the rich, history that we've had and legacy we've had in this business.
Dev, I'm glad I asked about that. Thank you so much for joining me. It's so interesting to learn more. I hope you come back and keep us posted on the developments that are coming. Thanks for your time today.
It's my pleasure, Stacey. Again, thank you for having me. It's always a privilege to talk about the important work that people in our company are doing all around the world.
You're listening to Diabetes Connections with Stacey Sims.
More information about Embecta and our conversation at diabetes-connections.com. I bet a bunch of you could fill a diabetes museum. I'm glad I asked. I wasn't kidding, but I didn't think he'd really have an answer for that. And I'm glad he talked about it. But right, we could definitely start our own. I just have stuff from Benny from the early, mid-2000s. And I know many of you, as you listen, have stuff from 50 years prior to that. I love that idea. Hang on to your stuff. Okay, Diabetes Connections is brought to you by Dexcom, and we have been using the Dexcom system since Benny was 9. We started in December of 2013, and the system keeps getting better. Dexcom G6, FDA permitted for no finger sticks for calibration and diabetes treatment decisions. You can share up to 10 people from your smart device. G6 has 10-day sensor wear. You know, the applicator is so easy here. We have not done one insertion since we got it, which was a big deal because with the earlier iterations, we were doing everything for Benny. And now, he does it all himself. Of course, we love the alerts and alarms and that we can set them how we want. That has also changed a lot over the years. Benny is much happier now that I have fewer alarms set. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. To learn more, go to diabetes-connections.com and click on the Dexcom logo. Doing a little time shifting, a little bit more than usual, always time shifting on the podcast, recording at least a few days before we air. But I, as you listen, am traveling with my daughter. This is her spring break. It's her last spring break in college, and we are spending it with family. I'm really grateful for that. There will be no newscast this week. We will be back with our regular schedule next week. A lot of holidays to mark. If you celebrate, wishing you a very happy Passover, a very happy Easter. 2 holidays where I got to tell you, tough to figure out those boluses. Matzah does not make it easy, and neither does the Easter candy. But I'm wishing you joyous holidays, whatever you celebrate. Thank you, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.